Welcome, and thank you for taking the time to learn more about obesity. This isn't just another health talk. This is about you and your journey to better health. Whether you're here for yourself, a loved one, or simply to learn, we truly appreciate your time. Obesity is a big topic in the media, but we also know it's deeply personal and sometimes difficult to talk about. You're not alone, and there's no judgment here. This is a safe space to learn, ask questions, and take the first steps toward a healthier future. By the end of this session, you'll have a clearer understanding of what obesity is, why it happens, and most importantly, what you can do about it. No matter where you're starting from, small changes can make a big difference. Let's take this journey together, step by step. So, what exactly is obesity, and why is it important? Obesity isn't just about weight. It's about having too much body fat that affects your health. It's not just about how someone looks. It's about what's happening inside the body. Obesity is important because it can negatively health, and it increases the risk of serious health problems like diabetes, heart disease, and even cancer. Studies have shown that obesity also reduces life expectancy. That's why we are talking about it today, because understanding obesity is the first step to managing it. Health providers often use something called body mass index or BMI to measure obesity. It's a simple calculation using your height and weight. A BMI of 18.5 to 24.9 is considered healthy, while 25 to 29.9 is overweight, and 30 or above is obese. But here's the thing, BMI isn't perfect. It doesn't measure muscle or body fat percentage, so it's just one tool providers use. If you're unsure about your weight status, talk to a healthcare provider who can give you a full picture. So why does obesity happen? Obesity isn't just about eating too much. It happens because of a mix of things such as genetics, lifestyle, environment, and even mental health. Sometimes it's due to medical conditions, certain medications, or hormonal imbalances. And yes, eating habits and exercise play a huge role too. It's important to remember this isn't just about willpower. Obesity is complex, and every person's situation is different. Obesity affects more than just weight. It impacts your whole body and mind. Physically, it can lead to arthritis, high blood pressure, diabetes, heart disease, sleep apnea, and even cancer. Also, socially, people with obesity often face bullying, discrimination, and social isolation. As well as physical and social health, obesity affects our mental and emotional health as well. It can lead to depression, anxiety, and emotional eating, and some people may struggle with negative body image, shame, and guilt. This is why obesity isn't just about losing weight, but it's about improving overall health and well-being. If obesity causes so many health problems, then treating it is critical. Losing weight, even just 5 to 10% of your body weight, can have long-lasting health benefits. It can help you feel better, move easier, and live longer. The goal isn't just to look different, but it's to feel better, move easier, live longer, have more energy, and less health problems. The best way to start? Small steps. Instead of overwhelming yourself with huge changes, focus on little victories that add up over time. Set realistic goals, like losing 5 to 10 pounds instead of aiming for 50 pounds all at once. Next, plan your meals and get into a consistent exercise routine. Also, remember to build a support system of friends, family, and even a healthcare provider to keep you motivated. Did you know that what you eat can be as powerful as medicine? To change your diet, focus on eating smaller portions, less carbs, and reducing sugary drinks and junk food. Remember, if you are trying to improve your diet, don't buy things you want to eat less of. For example, you are less likely to eat junk food if it's not in the house to begin with. Let's start thinking of food as medicine. Less salt helps blood pressure. Less sugar and carbs can improve blood sugar levels, and more fiber helps with digestion and even lowers the risk of cancer. Changing your diet doesn't have to mean giving up everything you love. It means finding balance and making choices that work for your body. Exercise isn't just about the gym. Walking, dancing, swimming, or anything else that gets you moving counts. Try to aim for at least 30 minutes a day, 5 days a week. And small things help too. Park farther away, take the stairs, clean the house, do some gardening, because it all adds up. If you change just one habit today, that's a win. Maybe you take a short walk after dinner, or one less soda a day. Over time, these small changes lead to big results. For some people, lifestyle changes alone aren't enough. That's where medications can help. Weight loss medications can help control hunger and cravings. They can come in both pill and injectable forms, but they work best with a healthy diet and exercise. Always talk to a doctor before starting any medication. Some pills, like phentermine, help you feel full longer and give you more energy, but they can have side effects like dry mouth, insomnia, or increased heart rate. Some people should not take appetite suppressants. For example, if you have a history of cardiovascular disease, glaucoma, trying to get pregnant, or breastfeeding, then you should not take this class of medications. Other oral weight loss medication options are available like orlistat, metformin, or bupropion, but still require lifestyle changes to be effective. Injectable medications are a class of medications called GLP-1 receptor agonist. They work by controlling blood sugar and making you feel full. They are given as a shot daily or weekly. They can be a great option for some people, but like any medication, they can have side effects like nausea, indigestion, constipation, diarrhea, fatigue, headaches. Common medications in this class consist of liraglutide, brand names Saxenda or Victoza, or semaglutide, brand names Wegovy or Ozempic. Another injectable medication, tirzepatide, brand name Mounjaro, Zepbound, use two hormones to help with insulin and appetite control. This is a breakthrough in weight loss medicine, helping people manage diabetes and lose weight at the same time. Mounjaro is approved for patients with type 2 diabetes, and Zepbound is approved for patients for weight management and sleep apnea. This class of medications activates two hormones in your gut to help your body lower blood sugar and control appetite. At first, these medications were so popular that there were shortages. Some pharmacies started making compounded versions of the branded medication. However, now most of the brand medications are available at your local pharmacy. For safety reasons, always check with your provider before using any new drug. For some people, surgery is the best option. There are different types, such as gastric sleeve, which is the most common weight loss surgery in the US. It removes part of the stomach to reduce food intake. Another surgery is gastric bypass, which creates a smaller stomach pouch and reroutes digestion. Another option is lap band, which places an adjustable band around the stomach, which can be adjusted or removed. These are just a few surgical options available. It is important to speak to your healthcare provider to determine if surgery is a weight loss option for you. However, it is important to remember that surgery is not an easy fix, and it requires lifelong changes to work. Losing weight is tough, but keeping it off is even harder. Consistency is key. Regular healthy habits help maintain long-term weight loss. It is important to stay active to prevent regaining weight. Also track your weight and meals to stay on course. In your weight loss journey, setbacks are natural and life happens, but what truly matters is getting back on track and staying committed to your goals. Weight loss is a chronic long-term journey. Medications and surgery are not cures for weight loss. They are treatment tools to support your lifestyle changes. It is important to have realistic expectations and know that once most people stop weight loss medication, their weight will return if lifestyle changes are not in place. In your weight loss journey, setbacks are natural and life happens, but what truly matters is getting back on track and staying committed to your goals. Remember, obesity is a long-term journey. Medications and surgery can help, but lifestyle changes are the foundation. If you're looking for more support, talk to your healthcare provider and visit unimedacademy.com. Join our weekly live webinars and workshops through the Health Masterclass to stay on track and get expert guidance. Thank you for being here today. The fact that you're learning means you're already taking the first step toward a healthier you. Keep going. Your health is worth it.